just a very small increment of the Herculite Ultra. And some of the things that I hope you'll notice here is just how nicely it sculpts to the tooth. I'm using gentle touch, and how as I sculpt it, it stays where I've put it. And that's really, from a handling standpoint, that's what you certainly, I know all the clinicians are very aware, they're very aware that is what we'd like to have, is nice handling properties, but we don't want this material to slump. Give me just a little bit more. So you want to be able to put it, push it, get it where you want it, but then you want it to stay there. And that's the one nice thing that this Herculite Ultra does. Those that have used Herculite through the years, I've been a Herculite user for over 20 years, and Herculite is a stiffer material. And so you have to really push Herculite a little bit more, but it's still, Herculite has been on the market 25 years of proven technology, fabulous material. What they've done is put in some nanofillers in this, and hoping that because of the nanofiller particles in the Herculite Ultra, that borrowing from the same chemistry of Herculite, that will in fact have the great strength that Herculite has had through the years, but a little bit better handling properties, and a little better polishability would be nice, especially the maintenance of the polish. I would rarely today use Herculite on an anterior tooth, but certainly I use it on lots of post. And I'm going to leave just a little bit of room for I am going to put just a little bit of translucent down, even though it's not that far off. This I almost could get away without even putting any translucent down on this, to be really honest with you, but I want to make sure she has very translucent lining, those transition zones on her teeth, and I want to make sure I hit that. But you can see how just I lightly touch it, and it goes right where I want it and stays there. So I've extended, you can see hopefully that I have taken it a little bit past the bevel. That's what I like to do with the material, and we will finish it to infinity. So just thin it out, thin it out, thin it out there. All right, I'm going to go ahead. So now I'm using the demi light, which really is a very nice LED light. It's really lightweight, fits in your hand nicely, easy to have around your operatory. You don't have a cord. And we just put a nice sleeve on it here, keep it clean, safe between patients. It's got a small footprint of a battery pack, so to keep it charged, so you're not taking a lot of operatory space. It's a nice light. And now I'm going to use just a little bit of the incisal light shade, just the smallest amount here of a second layer. As I said, I probably could have got away with it really with one shade, and that's really was the design of the Herculite Ultra material, was to try to keep simplicity. They've cut down on the number of shades in the system versus the Herculite XRV, so trying to simplify the shades, don't make it so complicated, but still cover your basic shades that you need when you're doing your direct composites. Again, look at the way wherever I put it, it stays, and that's what I like to see, and I think most dentists like to see when they're doing direct composites. Does the material stick to your instruments? And you can see it hasn't stuck to the instruments. And I put it on there, just light strokes, light strokes. Okay, so you can see, really just put on a very thin layer, second layer there, very thin amount. So hopefully you get a feel for how, simple the system is. If you've taken a composite workshop from me before, many times I'll teach you need to use 2 or 3 shades, and many times I'll use tints. Now she didn't really need any tints here. I think you'll see how this is going to be rather seamless and have a nice chameleon type effect as it blends in from the restoration to the tooth interface. Really should be undetectable, hopefully, when we're done. So I've set